Thank you, Lauren. Thank you, Dr. Rowland. I wish I was heading up at Department of Performance Monitoring Evaluation, but I'm really a small player in the field. There's a big department there. I want to actually deal with the discussant role in a bit of a mixed fashion today because I have many hats on that I want to bring to this forum. Specifically with my occupational therapy background and having been not just a service provider in the professional field but also activist in the disability sector with some of the pioneers, and Maria Ranto being one of my mentors in the field. But at the same time, interrogating research and research evidence, which is what we probably are here for as a seminar within a university setting. So I'd like to bring those two together, and really, I've read the report over the weekend, and there was just so much of areas that I would have wanted to bring in, but I'd like to maybe group it together, so that also in the presence of Dr. Leila Patel, you don't know it, but I've been quoting a lot of your work through the review process. So I'm drawing on a lot of different experiences. So one comes from occupational therapy, two comes from doing a lot of research projects within HSRC through poverty reduction and gender studies, matching gender and poverty and disability issues, introduced to the developmental state and working with policy analysis issues, programmatic responses, and really now coming with what does all that mean and how do we contribute to the disability sector. So number one, I want to really congratulate the team and not just in terms of another research project, but being responsive to a research need that was identified by the disability sector itself, by the disability movement. And when those kind of relevance comes together with expertise, then you get produced with such quality work. So in a way, any kinds of research that's available in the field of disability is most welcome. Having said that, I think just being amongst researchers and academics in the disability sector, it's also just good to interrogate some of the methodology and findings, because in a way, research evidence and what we produce over the years, the question is, why are the outcomes for people with disabilities still so poor? Why are we still struggling 20 years later? And I really want to also draw on the experience of having managed the 20-year review process within the presidency, of which disability was one of the 21 thematic areas that was identified to be part of the review process. Meaning that there's a synthesized report, but at the same time, disability itself had gone through a reflection exercise of what have we achieved, what have we still remaining challenges that we need to overcome going forward now. So in that kind of experience of being with economists and policymakers and bringing in the disability sector, how do we play the game? How do we actually bring in the relevance of issues around poverty and disability? So this is why it's so hard. Lauren, you made a big mistake of not giving me a time to be restricted to, but you will stop me, and I think that's why I wanted to categorize how much of areas that I wanted to pull together. So let's just start with the research approach and the methodology. Having identified a research area of work is already a strategic point of departure. And for that reason, the approach of actually using secondary data was very welcome. in the sense that it shows that you've gone into the knowledge base, interrogated it, and shown what the limitations of the actual knowledge base is. And the NIDS study is what was promoted within the presidency in the National Planning Commission, and the service provider is the UCT group, because longitudinal studies have not been, over the years, have not been given the kind of credence in terms of data collection that followed the same people around. We've had the Birth to 20 research study that followed and gave very nuanced, very contextualized understanding of following people through. The NID study comes now very welcome. It's rich in the data, and for that reason, very welcome to the research team that actually used and interrogated that data. While I think that Jackie and Lawrence said that it was constrained in the study was constrained in what they couldn't really do because of the way that the data was collected. It also rings a bell as to 20 years ago, we're still talking about how do we collect relevant data for disability, which is still a problem. Balancing between quantitative and qualitative. We've noticed that a lot of qualitative research brings in the lived experience of disability. And from the alliance we have with the disability movement, we understand that, and we know how much of different factors and different dimensions play in disability. Yet somehow we cannot draw generalizations. And Dr. Roland mentioned that this research finding, these data that was generated is very important for planning. And that's exactly what planners want. They want hardcore, what is the extent of the problem? Who are we dealing with? And that goes into resource allocation. And from a state perspective, how much of resources is needed? And when that aspect is not sorted out, you understand what we're talking about, the trickle-down effect of you will get what you just, what's left behind. And I'm going to come to a policy implementation and planning issues in a while. So that's critical around how and why we collect data. So in a way, some of the contextualized nature and experience of disability at a very local level still had to be understood and translated to national levels. And then again, the opposite is also a problem, where you have national aggregates, prevalence rate of 18%. It was between 6%, 2% in some areas, 10% somewhere else, and the average comes out to 18%. So where are we finding the biggest problem? We have provinces now and geographical differences. Which provinces are we talking about? It was very welcome to see that Mpumalanga was used for case studies that was matched to the Gauteng, the cases that was used in Gauteng. But at the same time, it was acknowledged in the study that Mpumalanga had an advantage of some of the very strong disability rights movements in action there. What about areas where there's absolutely non-existent rights-based work that's happening, as well as post-service delivery? So a little bit of maybe comparative analysis there would have been useful. So in terms of more contextualizing, we saw the findings in terms of how many are unemployed versus the non-disabled. But what's the level of community development and maybe district level development issues that are surrounding those kind of cases? Contextualizing it within a development perspective that speaks to why poverty exists still and is not being overcome is also useful. So just in terms of methodology and approach, there's both give and take in that way. And I specifically want to address something very very deep in my heart that goes to why even at the United Nations level, it's was stated there's a paucity of disability-related research. And you know, as some of us that have been in the research field in disability for a long time, shouldn't we now be interrogating what kind of research is this? What kind of research is needed in these fields? And having done research for not just for the academias and for the Human Sciences Research Council, but this review process made us interrogate what knowledge base exists. And unfortunately, what we're seeing is that there's a lot of professional related research development areas of work. Still couched, may I say, in the medical model. What's very severely lacking is service development research. And I'm going to couch everything around program development, strategy development. How do we translate the policy, progressive policies that we all know South Africa is so famous for, into actually programs? How many programs exist just for disability per se? So service development has been sorely lacking, and we will find that there's very few research that is at the level of policy and program development, which are couched under service issues. So that would be for myself as well, not just criticizing one or the other kind of research outputs, but as a collective. I want to just maybe go into more substantive and content-related issues around disability. And again, I now draw on specifically three bodies of knowledge. The development theories around which poverty is couched in, a lot of work around gender studies, and I think that's the area of work that we see, identity issues, mainstreaming versus targeting, and the kind of groundbreaking work from Amartya Sen, and then from our own local work in terms of capabilities approach. And then actually in terms of institutional economics and looking at how within a state, what is it that we're talking about, and how do we understand from an institutional level, not organizational, but the rules of the game. So drawing on that, what we're understanding to be in terms of the issues around definitions of disability, and at the core of it all is people with disabilities trying to have an identity and a belonging and being treated as equal citizens in a country. So from that perspective, it's not just about living in a community, but the relationship with peers, with community members, and with the state, and how do they play that out. So in terms of the approach, the capability approach, I think what would have been even more useful in this kind of a sense is the interrogation of agency. Who and how do people with disabilities voice their opinions, and what structures are available to be able to say and bargain with different people to be able to meet their needs. And what we're talking essentially about is the kind of lives people choose to live against the capability approach. And I think the capability approach has been couched, if people are familiar with the National Development Plan, in terms of what it is that people, the kind of choices people make in how they want to choose their lives to be lived. So agency, and what we're talking about here in these findings are at an individual level. What about the family and community level? What we are seeing in the study findings, which is actually quite refreshing, is to see that more people with disabilities are living with families. Households have increased over the 20-year period, the number of households. But the number of household members living in a household is still, the ratio is still more for female-headed households. meaning it's women that carry the pressures and the burdens of caregiving. So caregiving was stated. And again, I'm going to be a bit provocative in the sense that if we shift caregiving to families, how much of support do we give to families in order to give this kind of care? What kind of assistance, state support assistance? So the National Development Plan is critical of the fact that maybe that model hasn't worked, where the burden of care has been shifted to families in the absence of actual family care and the kind of interventions and strategies, specifically with the kind of migration patterns we've seen. Why are more urban, we used to know of people with disabilities being taken care of in the rural settings because of more family environments there, but now it's shifted. So because it's a similar trend in migration patterns where young females are migrating to urban areas in search for work because of more women's rights being recognized. And so there's a very, and Lauren and team have found that gender studies and gender differences are more pronounced in terms of how disability seems to be acting out. What we're also seeing is the social security and the grant system alleviating poverty. The 20-year review had, without all the economists were in the room, and there's been huge debates around income poverty versus expenditure poverty and the measures around poverty, but there's been agreement that poverty levels have decreased. But yet again, it's the kind of disaggregated data we need at local levels to be able to understand and interrogate what is it that people with disabilities at the local level, what levels of vulnerability still exist. And it's not now talking more about the dimensions of vulnerability and marginalization that even people without disabilities are experiencing at local levels. And if you just think about the kind of identity that people who are poor, whether you are disabled or not, people who are poor have experienced at a more local level to be marginalized against those that the haves and the have not. So in terms of that, we should be able to draw on the different similarities across development studies and gender studies. The measurements the difficulty with the measurements, I think it's already been clearly set out that without the kind of data that we're looking for, planning, which Dr. Rowan has so upfront said, that planning and resource allocation is going to be non-existent. What I would like to ask this House is, in terms of policy implementation now, what's our role in terms of strategy development? We've been talking about targeting and institutionalizing versus inclusive education. We've been talking about CBR. We've been talking about the differences in targeting of older people and differentiating with the needs of the child in a school setting. We don't actually have a strategy or 2 or 3 strategies to define programs. And I think that there's solely a lot of work to be done in translating policy into strategies and agreements. But having said that, what's our theory of change in designing whatever area of work we want to deal with? We are able to tap into what's existing in terms of the broader frame. But number one, can we actually adopt a unified definition for disability? We've been going back and forth over the last 20 years. And actually, maybe, can I say, standing still around this issue, because without that, we see measurements, data collection, planning issues all being affected by the fact that we don't have a unified definition of disability. We talk about a narrow and a broader, but at the same time, what is South Africa's position? how do we actually focus on equality of outcomes? We've seen the disabled versus non-disabled categories, but in the broader scheme of things, poverty is dynamic. People can move in and out of poverty as well. But we've seen schools being built in the name of equity and access. And if I ask you, what do you mean by equity and access? Because we didn't have it before, we want it now. But is it a good thing to have now? We need to be interrogating those kind of things. One question that keeps coming up, and I got introduced to be in the presidency, but I'm not there in my past work as disability. And what I found, even within those circles, who are the champions in our disability work? Is it people with disabilities? Is it the professionals? We've been going in and out, but at the same time, there needs to be champions for disability-related work at all levels, starting from the community. And I think that we need to have that kind of platforms created now. We spoke about agency, but at the same time, linking agency to the active citizenry issue. We have criticisms from and by people with disabilities themselves to say that the vibrancy pre and post 94 of the disability sector has been lost over the years. And can we revive that in order to make sure that representation is still there? We do not have agreed understanding of how do we meet differing needs among people with disabilities. Do we target? Do we mainstream? If it's target, is it blanketed targeting? Do we know where the priorities are? Do we know at a local level which needs and which geographical areas is more in need for service delivery to be more effective as well? And at the same time, disability is a transversal issue at a service provision level. How do we develop systems rather than focal points, systems-wide issues? So I leave you with one question, and it's that how do we want, as a collective now, to effect change in the capability of people with disabilities in South Africa, for people with disabilities to live the life that they want? Because are we acting as a united force around this? So I'll leave you with that. Thanks.